women do end up with full-blown diabetes. But we're going to prevent that. We're going to be going into the diet and what we should be doing to sort of cope with this diagnosis. So, about gestational diabetes, so just giving you a little background. So, 1 in 10 pregnancies are associated with diabetes. So, 90% are gestational diabetes, and then 10% are women that had diabetes prior to pregnancy. So some women start having, they go to their pediatrician or they go to their gynae, and the gynae says, okay, your sugar levels are a little bit high. Let's just monitor and make sure that they're not over and above the range. Then comes to about your last trimester, and they do the blood sugar levels. Everyone gets your sugar levels tested. So blood sugar levels are the same thing, and they end up telling you, no, you got gestational diabetes. So a lot of these women that are usually are ones that go to your doctor regularly and get these tests done. Some of them are undiagnosed or mismanaged gestational diabetes patients, and then it leads to complications. We have fetal issues. We'll get into what can happen with gestational diabetes. And obviously, mom and baby, you're not just eating for one, you're eating for two now. And mom and baby are at risk of having diabetes later on in life. So, as you can see from this picture, the little tube is sort of like your whole body. There is an amount of fluid in the body, and if we're adding sugar to it, it becomes very sweet. Now, obviously, this baby loves sweetness. It loves food like most of us, and it craves it, but it's not good for baby. So baby can be born too big or even grow too big within the womb and then have to get your cesarean. You can have a preeclampsia, so meaning higher blood pressure, meaning baby will come sooner than needed, meaning baby is also coming sooner means baby's lungs not going to be developed as much, baby's organs are not developed as much that baby should have been developed. And also, as you can see, there's risk of injury with birth, so that doubles the likelihood of a C-section, triples, and ICU admission risk after giving birth quadruples. So everyone asks me this question: am I gaining enough weight? Am I too skinny? Am I that pounds? And you know what? Everyone is different. Every single patient, we come in all shapes and sizes. Yes, there is the BMI, which is the body mass index, so how much you're supposed to weigh before pregnancy. But we don't want you to lose weight during pregnancy. That is not my goal. I want you to make sure that you're gaining weight because that means baby's growing. Okay, yes, after pregnancy, we'll work on getting that tummy a little bit smaller because everyone picks up weight during pregnancy. Just one of those things. But a lot of mom tell me, okay, but I want to know how much I must weigh and how much calories I must take in. So the weight during pregnancy depends on the weight prior to pregnancy. So if you are small your whole life, you're not going to gain as much weight during your pregnancy. We get worried when you're not picking up anything, and usually that's when your doctor refers you to myself. And we go through the diet, seeing what is missing, what needs to be added in. There's also nutrition, diet related side effects from pregnancy. So some women have severe nausea, some of them are vomiting and throwing up, especially in the beginning of pregnancy, and second trimester. And I help them just overcome some of those struggles and those battles. During third trimester, our goal on my side is to have at least 30 to 35 kilocalories per ideal body weight. You see, you're not going to understand that because that's my job. I work out the numbers, I work out how much, and are you getting enough percentages of certain nutrients. Your job is to just eat. So the best solution for gestational diabetes is there is obviously medication. So you would be using insulin or your metformin. But mainly, doctors usually suggest in the third trimester use of insulin if your sugar levels are very high. But the main thing to go for first is changing the diet. So using medical nutritional therapy, which is myself. So you'll be getting counseling from a registered dietitian, which please go to a registered dietitian. Your nutritionist or your, I don't know, anyone at the gym, they are not eligible to give you nutritional advice during pregnancy. This is a more medical related issue, which a registered dietitian should be helping you with. I help out, find out what is your specific weight that you're supposed to be during your pregnancy. I work out specifically how many calories and the composition. So the calorie breakdown is kind of just a ballpark figure. I first look at what are you eating now and trying to work with that. So about 40% should be carbohydrates, 20% should be proteins, and 40% should be fats, healthy fats. Okay. So the next thing that we usually discuss with the patients coming in is they get the gestational diabetic diagnosis, and they're like, do I need to measure my blood sugar levels all the time? Must I go and get that little machine and poke myself? It's patient specific. So I don't want everyone to go rushing all by glucometers and pick themselves 50 times a day. It's dependent on what is your sugar levels, how badly was your test that you did with your doctor, what are you eating. So you'll get that advice from your doctor or from myself, how often you should be measuring your blood sugar levels. But a lot of women that have gestational diabetes out there, they want to know what should my normal values be during pregnancy. So because during pregnancy, we're getting that the fetal growth, the womb is getting bigger, more fluid is coming into the body. It's sort of like you're taking your normal glass, one glass, and you're adding more fluid to it. So that means there's more room to work with the values. So if we're taking 2 teaspoons of sugar and putting it in a glass that's bigger, it's sort of less diluted, but it's still dangerous for baby. So the blood sugar levels that we work on for fasting, according to the American Diabetes Association, is 95. Then 1 hour after your meal, it should be less than 140, and then your 2 hours after a meal, 120. So I like looking at also the ones that we're monitoring over a long period of time. I like looking at what is the pattern, what is the trend. If there's one day where it's like Christmas is coming up, if there's one day where the sugar level is like 150, 160, 1 hour after meal, okay, it's not great, but it's not happening every day. The rest were all in range. It means you're doing a good job. So don't worry too much. Then now let's get into more of the food section. That's why you're here. That's why you want to listen. So the role of food in diabetes management, especially with gestational diabetes, is broken up into different categories. So obviously you need energy, baby needs energy, but where is this energy coming from? So you're eating the food, which is consisting of a healthy fat, a carbohydrate, your meats, your dairies, your fruits, and your veg. Each category food group sort of influences our blood sugar level in a different way. So the ways that it can sort of influence depend on person to person, but I like categorizing those into those groups. So we have to make sure that we look at four different things. Okay. First one is how much carbs are you having a day? I will be monitoring the numbers, but I want to just focus on the portion sizes. So what kind of carb are you eating? Okay. So is it a high fiber carb, or more of your refined starches, so your white breads and the white carbs? So those tend to make your sugar levels spike quicker. Then the third one is, when should I eat these carbohydrates? Some people, sugar is much higher in the morning, so we suggest maybe a lower carb breakfast. Or some patients, their sugar level drops in the evening, then recommend a late night snack. It depends person to person. And then also the last fourth point is, what are we combining? So we need to make sure that we're taking a starch and pairing it with a healthy fat or protein. Never have a starch alone. Rather have it with something else. because then it allows the sugar levels to not increase at such a higher pace. So please, I don't expect you to just like this lady in this photo, just eat salads all day. You need that energy. You need that healthy fats, your proteins, not just having salads all day while you're pregnant. Your baby needs all these micronutrients. Okay, so firstly, let's get into the nitty gritty. So the first group is carbohydrates. So you're thinking, okay, carbohydrates, starch, those are the same kind of words. If you think about your carbs, they are the ones that make your sugars high. So I think of them as a block food. So a block food meaning it makes your sugars go high. So 1 teaspoon of sugar is equal to 15 grams of carbs, which is equal to a portion of carbs. So that's what I think in my brain. But I don't want you to think about that. I want you to be thinking about portion sizes. Don't think about carb counting. It's not important for you. So, what is examples of carbohydrates? So, what will be making your sugar levels go higher? So, obviously, things like cassava, plantain, potatoes, things that have sugar in it, like your sweetened milks and yogurts, your fruits. So, a lot of your fruits tend to have higher amounts of. They are fruits. Some of them are higher in sugar and some of them are lower in sugar, but everyone digests fruits differently. Please do not take fruits and cut it out completely. Your baby needs the vitamins and minerals, but with your dietitian, we'll discuss what types of fruits work better for you. So the less healthier options, like your takeaways and fast foods, those influence your sugar levels. Sugars, okay, brown, white, yellow sugar, even if it was pink, all sugar makes your sugars go high. All right, except for your alternative sugars, your sweeteners, those are fine. Then obviously your crisps and chocolates and sweets and biscuits, all those nice things, those are the ones that make your sugars spike the fastest. And then obviously your ready-made meals, so anything that you just microwave or put in pop in the oven for 10 seconds and well 10 minutes and then it's cooked. So those are the ones that make your sugars go high immediately. So let's get then what must you eat? I just told you those are the ones that make your sugars go high. Then you're like, okay, I'm gonna go completely carb free, but that's not what we must be doing. Baby needs carbohydrates. Baby needs to have that brain power. Baby can't take protein and healthy fats and just get the energy. So think the more whole grain, the better. So at the shop, they will say multigrain, or it will say high fiber. High fiber is good, but it will say high amount of seeds. Okay, just go for one that you read the nutritional label. You go for your dark breads. You go for your lentil or your whole grain pastas. Rather go for your high fiber breakfast cereals. Try and have maybe legumes that are higher in fiber. Also helps tummy go. Some people have constipation during pregnancy. I know you ladies need definitely your high fiber foods. Then things like brown rice or quinoa. Try out maybe venturing into more foods that you wouldn't normally have. Um, it is encouraged to have your carbohydrates, but in a certain amount. Then we get to your proteins. So proteins are on the table. You can have proteins as your snacks. You can include it with every meal because protein is important for your muscle development and also your repair for yourself. You also need to think about yourself during that time. So your protein sources that would be healthy is your lean meats. You can have red meat, don't worry. Your fish, your nuts, different sources of your dairy products as well. A great source of protein is also even your flax seeds and chia seeds and your eggs. So try and go for your high in omega-3 fish, so your mackerel and tuna, those are good for you. Try and cut down on your processed meats. So your Viennas, your meats that are your deli meats, things like your processed cheese, all of those types of foods are a little bit more healthy. They have not natural ingredients. So go more natural as possible. You don't have to go all organic. But just try more whole foods. That's what I'm sort of the pattern I'm going for. The next sort of area food group is your dairy. So go for your low fat products. A lot of people say, oh, but what's left after they take out all the fat? There's still nutrients, there's still protein within your dairy products. Try and watch out for your. A lot of people go for low fat chocolate milk. It will have sugar in it. Try and go for your low fat. Don't always go for. You don't have to go for almond milk or oat milk. You can go for your dairy milk, but try and go for more your low fat options. I like to say the lighter the cheese, the better. So cottage cheese is great. Your normal mozzarella is really great. You can even have that as a snack, pieces of cheese during the day. Your feta cheese is the exception to my rule. So feta is usually higher in salt, and we don't want the blood pressure going up because it causes preeclampsia, which can cause babies to come a little bit earlier. So try and keep the salt on a minimum when it comes to products, but you can still add a little bit of salt onto your foods, especially now that it's like it's very hot and you're sweating a lot. Make sure the electrolytes are still there. Another source of your dairy products is your yogurt, which is really great, full of probiotics. So your low-fat yogurt you can have in the morning or as a snack. You can even mix your fruit with your yogurt. Veggie. So I love this picture because it shows that there isn't just one type of vegetables. So me and my house, we have green leafy veg all the time, but we're actually not tapping into the other nutrients. So there's your beetroots and your sort of purple vegetables that have the B12. Then we get into your orange groups, which is higher in vitamin C. So it's important to have a variety of different vegetables and not just the same one all the time, because each color has a different vitamin and mineral. And you want as many vitamins and minerals for baby as possible. Then with vegetables, okay, some people say you get your squash. So butternut, usually your acorn squash, and then your pumpkin. Everyone says, okay, that's my veg for the day. But that's a little bit of a starchy veg. So if you're having those sources like your butternut squash and your pumpkin, your cassava, your plantain, they're sort of like more of a starchy veg that would be more on the starch portion and not your veg portion. So always just try and look what type of um, veg you're putting on your plate. Your sort of starch free is your broccoli, your lettuce, carrots, any type of your cauliflowers, onions, celeries. Those are your starch free veggies that would be great for you to have. Then your fruits. So everyone says, okay, what fruits? I've heard that grapes make your sugars really high, or I've heard that watermelon. Oh, yes, doctor, I can't have watermelon because it makes my sugars go high. So every fruit is different for each person. They digest fruit differently. If I had to have fruit and test my blood sugar levels with someone else, it would be different. So I suggest that just have make sure that, like for example, this fruit that I have, this is too big. Try and make sure that you can put the fruit around your hand and touch finger to finger on each side. So a small fruit that can fit sort of in a lunchbox, that would be a great size. Also, maybe you can cut the fruit, but don't go for more than half of a cup, because then you start getting too much at one time. So allow your body time to cope with that influx of sugars. So try and have maybe the fruits between your main meals as snacks instead of having it with your main meal or your breakfast or your dinner. So match the fruit with a meat, like a piece of chicken, or match it with your veggies or a healthy type of dairy product. Then the next thing that we're going to get onto is your healthy fats. So I also love this diagram. I show it to even patients that don't have gestational diabetes. There's some on the left-hand side, your salmon, eggs, olive oil, flax seeds, and chia seeds, and avo. Those are your healthy sources of fat. And then on the other side, it's your more unhealthy sources of fats. So things like your animal products like butter, your whipping cream, your fattier cuts of meats, and then your palm oil and more of your vegetable oils. Those are the unhealthiest sources of fat because they have high amounts of saturated fat. The one that a lot of people are shocked about is the coconut oil. So, coconut water, please have it. It's really high in electrolytes. It's really good sources of vitamins and minerals, but try and not use as much coconut oil in your foods because you can see the amount of saturated fat. So we want that monounsaturated and polyunsaturated to help with anti-inflammatory properties, help make sure that your blood sugars are normal. So adding avocado to your salads or maybe some flax seeds. Even the other thing is your nuts. So nuts are really great to add onto your salads or onto your vegetables as well. Then always go for your whole foods. So your apples are obviously better than your apple sauce or your apple juice. So it's always better to go for whole foods as much as possible, less preservative, less colorants, and also you're getting more vitamins and minerals. A lot of people also ask me, your foods that you get at the shop, always go for the whole foods, then go for your frozen, and then obviously your tinned, because the tinned has high amount of sodium. So sodium is the salt. So go for your fresher foods. If you have to look at your timing, you remember in the beginning I said those four things you have to worry about. So what type of food, then the combination. So we spoke about like mix your fruits with a healthy fat or protein. So the third thing is meal consistency. So a lot of people, they'll say no, but I skip breakfast and I skip lunch and I have like snacks, little snacks, but I don't really eat a lot. Why is my sugars high? So having your sugar levels constant is the best for your pancreas. Your body tries to stabilize itself, so it tries to keep constant at all times. So if we're skipping breakfast, this pattern is going to go down and then it's going to spike right up when you have your next meal. So it doesn't really help with wanting to manage your blood sugar levels. So don't skip your main meals. Try have breakfast, lunch, and dinner during the day, and try and pack in your snacks. I know it's difficult. Some women hate snacking. They just want their main meals, and women just want to snack. But try and keep your blood sugar levels constant. Also, try and make sure, yes, you don't cut your carbs out completely. You need your balanced meal. Then this is sort of the best general suggestions I make to everyone. So make sure that half of your plate is vegetables. That's how we're going to do it for Christmas. Dish up your vegetable portion, half your plate. Then dish up your protein portion, and then your carbohydrates. So we're including the carbs. Make sure that if you're going to go for seconds, you go for your veggies and your proteins. So half the plate veg, and then quarter protein, a quarter carbohydrates. And then if you look at this plate, I just have some examples. This would be, so this person added fruit instead of the veg. I would suggest for this plate, we maybe change. Okay, we've got some fish there. That's great. Good source of omega-3. The veggies or green leafy veg, great. But can we maybe take the fruit and add it into a snack and have that milk portion with the fruit in the snack, and then change, maybe adding a different sauce like having cauliflower and the green leafy veg, and then take the pasta and move it to maybe whole grain pasta with it, or quinoa or brown rice. Next example is more of a balanced. I hope that those fries, I'm sure they are put in an air fryer or oven roasted. That would be your starch portion. And then you can see half is veg and a quarter is meat. So that's a really great plate. Next one, as you can see, this is a very mixed match of foods. So it's not really flowing nicely with the plate method. There's no veg. It's mainly just starch and meat. We want to have that balance. There's no vitamins or minerals, not a lot of vitamins and minerals and variety in this dish. But I would definitely then cut away some of the carbs, cut away some of the sources of the meat, maybe make it a little bit smaller, and then add some veggies in there. The next thing that's important is your nutritional labels. I promise you, these food companies, they try to lie to you. Try and make sure that your percentage daily value, which is the value on the right hand side of the labels, is less than 20% for your fats, your sodium, and your carbohydrates. We don't want to be going over with just one product. Also, look at the nutritional label. So, if you can see, this first ingredient is whole grain wheat. That means that the composition of the product is mainly whole grain wheat. And then the next ingredient is sugar. So, if you're buying something and you think it's healthy, but the second ingredient is sugar, it's not the best option to go for. So you can look for the high fructose corn syrup ingredient in the nutritional label as well. Try and avoid that. Then sugar alternatives. A lot of women ask me, what should I be using? As I said, brown sugar, white sugar, honey, all the same. They do spike the sugar levels. You can use sweetener or just try and cut down with the amount of sugar that you're using. Water, 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 water. So as many cups that you see on this slide, we need to make sure that we're diluting that blood sugar levels. So if you're going to have, obviously you're going to have a treat on Christmas Day, make sure that you drink lots of water during the day, and you maybe go for a walk, or you go um, do some online videos of Zumba with your family that morning, just to get the blood sugar levels a little bit lower for that treat. Probiotics are really great for the gut. The immune system needs to stay strong. So using sources like your gherkins, your cheese, also things like your kimchi, sauerkraut, those are really great sources of probiotics. Or maybe taking a multi-strain probiotic is really great. Prenatal vitamin, please take it. It's not just for first trimester, throughout. It should contain at least 400 UGs of of mainly of your that will be 27 micrograms of iron, 1,000 micrograms of calcium, and then folate, 400 UGs of folate. That's what's missing. It needs to be in your prenatal vitamin. This does not just mean that you cannot have any veggies per day. This is not going to cover all your nutrient requirements. Some women take these and they eat the foods during the day and they still don't meet their nutrient requirements. This is just a sample of a meal plan. So breakfast, whole wheat toast, so it's 1 carb serving, and then an egg and 1 cup of fat-free milk. Morning snack could be some almonds and a small apple. There we're pairing the fruit with the protein. Then the next is your lunch. So whole wheat bread with some chicken, low fat cheese, teaspoon of mayonnaise. We can go for the low fat mayonnaise. Lettuce, maybe 2 tomato slices, a stick of celery, and you can sort of make it your own. And some carrots are really great for lunch example. As another snack in the day could be some cucumbers, tomatoes, and some hummus. I've got really great recipes for hummus. You can get it made or you can make it at home. Supper, now that Christmas is coming up, some broccoli, brown rice, your green salads with some avocado and salad dressing, or vinaigrette, that would be better, and your chicken. Then maybe you're still hungry and you want a snack, rather go for your whole grain crackers and then some cheese with it as well. So that's pretty much, really in a nutshell, what you will be needing to know with your gestational diabetes. I suggest, though, medical nutritional therapy is the best way to manage your blood sugar levels. You're not going to, it's hard to do it alone. So please, I'm here. I'm waiting for you to give you lots of suggestions. And what I do is I give individualized approaches to every client that I see. We want to make sure that your baby is getting the best nutritional care because this is such a critical stage in baby's development. So thank you so much. And hopefully I'll be posting another video about a different topic, nutritionally related. So thank you so much for all listening. If you have any questions, please post it. And after, I will privately message you or I'll post it on the group to answer any of your questions. Thank you so much.